Thank you. Now I'd like to introduce our next speaker, and it's Jeff McMullen, and Jeff's our keynote speaker, and Jeff, an ABC foreign correspondent for almost 2 decades, a prize-winning Four Corners documentary maker, a long-serving 60 Minutes reporter, and now best-selling author. Jeff McMullen hardly needs an introduction to most of us. Some of us have watched him on television for over 35 years, and his commitment to human rights and improving the lives of Indigenous people in several nations spans his professional lifetime. Jeff McMullen reported that from more than 30 war zones, from Central America to the slaughterhouse of Rwanda, his revealing documentaries about the genocide against the Guatemalan Indians and the Amazonian Indigenous people, and that ride by helicopter to the world's highest war zone in the Himalayas. Few living storytellers anywhere in the world have gone to as many amazing extremes in the pursuit of an important story. The title of his memoir sums it up, A Life of Extremes. But for the last 4 years, Jeff has focused all of his storytelling skills on trying to tell this nation just one important story: the crisis in health and education among Australians' Indigenous people. As unpaid director of Anne Thorpe's Foundation for Youth Trust and an advocate for the Fred Hollows Foundation, Jeff is helping build strategies to give all our children an equal opportunity for health and education. Jeff McMullen has helped establish the Riverbend Readers Challenge in Queensland and the Literacy for Life scheme in the Northern Territory to improve the education of Indigenous people. His partner, Kim Holgard, and children Claire and Will have set out to show that every Australian family can contribute in some small way to the improvement of the health and well-being of all our children. So now I'll hand over to Jeff.
Good evening, everyone. Thank you, Julie, and thank you, Eric, for the welcome to country. This is your land, and more so, I suppose, after all of that world wandering that Julie's talking about. It's almost half a century of it, as I started as a very young boy. My appreciation of the Aboriginal people today and of their ancestors was deepened by what I've learned in that travelling, the impact that colonisation and conquest has had, and the very similar health patterns that have emerged around the world. It is important not to romanticise the past, but if we are to discuss a crisis today that is threatening Indigenous people, we must also acknowledge not only the ownership of the land, but the strength of this culture, the world's oldest continuous culture. At the Australian Museum, Professor Mike Archer now estimates that the real timeline for settlement in this country is closer to 100,000 years than those projections that all of my lifetime we keep rolling back. Think of that, 100 millennia. And you see that the children today of those ancestors have been on an extraordinary journey, not only surviving, adapting to profound changes. And ultimately, you have to see that these strengths are still in these embattled communities today that are fighting for their health. I believe, and I'll try and make this case to you very quickly, that Indigenous Australians are quite possibly facing the gravest threat to their health since the arrival of European diseases over 2 centuries ago. Tonight we are really examining the future and the health of those children of the first Australian sunrise. This year, about 10,000 Indigenous babies will be born. I see no greater challenge for this capital and for every one of us in Australia than to guarantee that each of those children has the same opportunity for health, as every other child in Australia. All 460,000 Indigenous Australians should be entitled to the same health care as every one of the other 20 million Australian citizens. It is their human right, that health. That is important to say from the outset. It is their human right, and it is our responsibility to contribute in some small way. Julie mentioned my wife, who was born in America, my children who were born here, and we have found in our family that it is possible to lend a hand. And I don't want you to listen to all of our words tonight and leave this room without finding a way. It is possible for each one of us to contribute something. Because we have so much in our heads, in talent, and in our pockets at the moment. Look at the wealth of this country at the moment. Most of us are living in a truly golden age in this country. Most of that 20 million citizens are so high on the hog at the moment. And if you get down to what Julie mentioned, her own, that's the reality. When she said the statistics tell her she won't be around as long as the public servants. Think of that. The truth is that we have here in Australia, for most of us, close to the best health care that I've seen anywhere in the world, despite all the moaning and groaning we do about the system. We have, in fact, close to the longest life expectancy in the world. To be precise, we are third behind Japan and Switzerland in life expectancy. 83 years for you women, 78 years for the men. Any other way you measure quality of life, for most of us, it is a golden age. Among the OECD countries, we're in the top 10 for personal income. And that organisation says we should be aiming to be the leading nation in individual income. I'm told that we have a federal surplus over the next 4 years of something like $25 billion. Professor Deeble can correct me on those numbers, and I know we're all awaiting to see what Peter Costello tells us is in that next budget. Maybe it's more. $25 billion is money generated by our effort as a nation. The people. It didn't just arrive in a miracle. We, the nation, generated it. And surely there is no more important indicator, really, of what this nation is all about than how we fairly allocate that national wealth to all of our citizens. That is why I say, and I choose these words carefully, that the health of those 10,000 Indigenous babies born this year is the real measure of our greatness, and it is the real challenge, the immediate challenge for this nation. Because out in the heartland of this country, and I've just come home from one of the communities that is devastated by these illnesses, the truth is that there is a cluster of chronic illnesses scything through several generations of Indigenous people. It begins with that infant, one of those 10,000 babies. They are born into disadvantage, and unless we change things very quickly, they will die in disadvantage, their lives cut short by illnesses that are treatable and are preventable. Syndrome X, the doctors in the Northern Territory call it, it's a cluster of illness. Diabetes, end-stage renal disease, strokes, hypertension and heart disease. It is, in my view, the new Black Death. It's a modern plague, and it is moving so fast that it is taking away the grandparents and the parents of those 10,000 children, faster than you can imagine. There is, in those remote communities and on the outskirts of cities like Canberra, even in the suburbs of Sydney and Melbourne and Brisbane, even in Bob Carr's home electorate between Maroubra, La Perouse and Malabar, there are patients with this pattern of illness. It targets the disadvantaged, the poor, and those who do not access health care. This cluster of chronic illness is largely the reason that Aboriginal people are dying 20 to 25 years before the rest of Australia's citizens. Many, many years ago, when I made films for Four Corners, I heard somebody in the United States tell me that sadly the diabetes and the renal disease among Native Americans was the result of a gene, like a genetic weakness. And that is the first dangerous misconception that we have to destroy. It is really a racist excuse for postponing the necessary emergency response to what is a true emergency here in our own backyard. Because the truth is a lot more confronting than a weak gene. Very recently, a combined American-Australian medical team from Monash University, from the Menzies School of Health Research in the Northern Territory, and the University of Mississippi, the American state that happens to have the worst obesity and diabetes and renal disease. And what this research team did was examine that myth. It wasn't their main question, but certainly they have shattered it. They found there was a tantalising common factor, but they looked at white people, white Americans and some white Australians, Indigenous Americans, Native Americans, Afro-Americans. They looked at Indigenous Australians, and when they looked into these people in autopsies, at those deaths, the common factor, it went across all of these races, but it hovered around poverty. The common factor was a dangerously low birth weight baby. What happens, and it has been confirmed by this research, is an old hypothesis known as the Barker hypothesis, is that the young mother, because of malnutrition, infections, and poor health care, in utero is really programming her baby for those early onset diseases. The kidney of that unborn child develops fewer nephrons, the working parts, the essential working parts of the kidney. And what you are dealt at birth is what you will live with. You don't catch up on nephrons. And if you have too few, they overcompensate. If you have an Aboriginal child whose nutrition is very poor and through eating on a bad diet can very likely develop obesity at a young age, the dangers are even compounded. The result is you get scarring of the kidney and ultimately kidney failure. This is the pattern of Syndrome X. It is not a weak gene, it is far more disturbing. The truth that we have turned away from in Australia is that here in a country that exports food to the rest of the world, we have hungry young mothers, malnourished mothers, who not only lack primary health care, they lack affordable, nutritious food. And as a result, that child is set up for disadvantage. Now, when I asked Ian Thorpe to come with me, Ian had set up a trust after the Sydney Olympics to try to do something to make all Australian children healthy. And I said, I will show you some of our sickest children. And we went to Jarwin country, which is down in the bottom of Arnhem Land to the east of Katherine. And Ian saw the result of this pattern of Syndrome X. You see babies that are not thriving. You see children that are stunted, who have not grown properly. And he was puzzled that so many of these older children couldn't hear him. So I pointed out, 25% of them nationwide have a serious hearing disability. Up there in Jarwin country, 80% of them have a serious hearing disability. It comes, glue ear as they call it in the communities, otitis media, comes from a middle ear infection in infancy that is neglected. The pattern is perforated eardrums, more neglect, no treatment. A totally treatable illness leads ultimately to one of the most serious learning disabilities. If that child turns up in school, she will never hear the teacher well standing at the front of the classroom. You set that child up with a disadvantage that they will carry with them right throughout their life. Ian's response when he looked around was to say, "What can I do? What can any one of us do?" And what those Aboriginal community leaders said to him was, the first thing you have to do, what each one of us must do, is raise our voice. We have to move this higher up the agenda. And it has to start with each one of us to make this our concern. A good question here in Canberra and for our nation's media is, why have we not been able to respond to this emergency with the same urgency that we did towards the tsunami victims? If you think about it, look how quickly the media informed us, very thoughtfully and responsibly. We looked at those people not as a mass number, not as a statistic. We looked out there and we saw a father who lost a child or a child searching for a mother. And very quickly, we, the nation, the people, moved. And our government, in my view, probably took the most enlightened decision, even if it is out of self-interest, but an enlightened decision. Our Prime Minister, with rare bipartisan support, not only took an emergency step, he promised long-term support for these people, our neighbours. You and I know we are capable as a nation of the same generosity of spirit, but we have to move this issue higher up the agenda. Put it up there with terrorism and water, which we talk about week after week, because this is a crisis in our backyard, and these are our children. We have to make this personal. We have to say, this is not about the other, it's not us and them, this is about our children, our people, our citizens, the 10,000 children born this year. We know that the support is not in place at the moment for those babies, but you know how easy it is to move and change and support those children and give them that equality of opportunity. Each one of us here tonight wants to put forward positive proposals to deal with Syndrome X. We are not here to carp about the past and to wallow in the misery. We are here to say that there are ideas. There are fresh ideas and there are ideas that have been long discussed that have not been acted on. We want to put forward clear solutions. But one thing certainly I would say that unites each one of us at this table is the absolute belief in one foundation principle of what can be done about this health emergency. A good doctor must listen to the patient. And so if we are going to overcome this health emergency affecting Indigenous people, we must listen to Indigenous patients. We must recognise that the communities themselves are going to point us towards the best solutions. I was really heartened to hear during the election on Lateline our Prime Minister say that after Noel Pearson had shown him around some of the projects in Cape York, John Howard said he had come to see that, in fact, if you did put power and control into the hands of the community, you would see that if they had the internal discipline in their hands, they could bring very rapid change. And that if they persisted at it over time, these problems could be dealt with. And only a couple of weeks ago, Senator Amanda Vanstone made her major speech on Indigenous health. And she said she recognised that Aboriginal patients going to health services, as Julie spoke of, and trying to find their way through that maze of services to find an answer, as the 2 or 3 chronic illnesses they were battling in their body were bringing them down. Senator Vanstone said she recognises that that patient cannot find their way through that maze of bad health. And the Senator's words also, which should be guidance for every one of us and for every agency and government department in this town, and for those in Parliament that are going to make policy about this, her guiding principle was, we need to find more flexible community level ways of recognising that patient. There's the foundation principle, and it's one that every speaker here agrees on. The truth is that at the moment, after a very long season of tension, occasional hate, we've come to a year that so much Indigenous policy is being remade, And there is a remarkable promise in the air, despite the scale of these challenges ahead. After Michael Long walked to Canberra and Mick Dodson and Pat Dodson sat with the Prime Minister, I could see in my lifetime a glimmer, at least, not to be optimistic, but to say, here's a chance to be on the same wavelength where we can work together. And every Indigenous leader I know, including Loetu O'Donoghue, and up in the Cape, Noel Pearson, and the Dodsons, Professor Dodson at ANU has said this in so many speeches. We need bipartisan recognition that this is the urgent challenge to this nation. We need to get past the division between federal and state governments and act together, listening all the while to the community, telling us what needs to be done. Pat Dodson pointed out that no matter what small ideas we each contribute, ultimately changing a health crisis can only be done if government invests fairly in dealing with that, in coming up with an emergency response. Now, Professor Deeble, I hope tonight will be able to clear up some of the confusion that is out there in the Australian community about this, because there are conflicting assessments of the true state of the Indigenous patient and of how much money really is spent on that patient. I know that the AMA, only a few months ago, updated its figures using Access Economics to make this assessment that it was around about $452 million of underfunding for Indigenous people. Now, you might have also seen ANTAR, Australians for Native Title and Reconciliation, who say that for every dollar spent on my children, about 70 cents is spent on Aboriginal children. I wrote to the Federal Health Minister. I wanted to be clear what his view of this was and what the government was operating on, what its thinking was. And the reply from the Health Ministry was, well, since the Keating years in 1995, 1996, there'd been a 90% increase in spending on Indigenous health, which by this year, 2005, would rise to about $262 million a year, which would still seem to be well short of what the AMA was saying needs to be done. Now, a lot of this isn't understood by the community because my profession, the media, and I believe the federal parliament, has done a very tardy job in discussing this in a way that people, we the individual citizens, can make much sense of. You are left wondering, is there too much spent on Aboriginal people or too little? What is the truth? So many people ask me. Until it was pointed out by Shane Houston, who was the Assistant Director of Aboriginal Health in the Northern Territory, who did a study with Professor Gavin Mooney that said, those numbers can be misleading, but let's go back to what I said, let's look at the patient. The Indigenous patient is about 5 times sicker than the non-Indigenous patient, according to Professor Mooney and Shane Houston. And they said, if you're going to get that person healthy, it's the same as if it's one of my 2 children. If one is 5 times sicker, do I begrudge the spending and say, I'm sorry, son, but you're going to have the same spent on you as your sister? Of course not. But that degree of disadvantage is really what we are wrestling with here. Pat Dodson is right. Until we get that out and discuss it, it's not about shuffling money around, it's looking at the patient. All I know is that in the communities that I've just come home from, there is an endless procession of funerals and grieving. I look at the tombstones and you know what it says in the national epitaph? It says, these people were born and died in disadvantage, 20 to 25 years before the rest of us. The figures don't mean much, but I know these people. That's why I said make it personal. If you look around the room and you imagine 45% of the men in this room not living to the age of 45, or 34% of you women not living to the age of 45. That's different, isn't it? It's unsettling. And you know that if we are allowing that to go on, it is wrong. You also know that it is possible to change it. To know that patient who is 5 times sicker. We need to have doctors that can communicate well with that patient. And tonight, Alan Eldridge from the Australian Indigenous Doctors Association will explain how crucial it is to have there on the front line of our Australian emergency Aboriginal doctors that are capable of listening to that patient, who can contribute so much. A health force that knows how to listen and understands those patients. Because if you had 2 or 3 or 4 chronic illnesses, I'm not joking, I go to clinics where these people have that number in their body, you would know it is bewildering. Their health is crashing so rapidly, they cannot possibly fathom what is happening. That patient needs an Aboriginal doctor to be able to help them. Indigenous health workers that can support them, that can speak their language when they go to hospital. The truth is, it's when that patient gets to hospital that the spending starts to catch up. It's when the man is on dialysis at $100,000 a year, then the spending starts to catch up. But what has become very clear to me is that out there at that stage, when it is possible to screen illness, to treat illness and prevent illness, is where there is a dangerous underfunding of the children that I spoke of. The children of the first sunrise, the first Australians, are usually thought of last. If we were to turn our thinking around, as Dr. Fiona Stanley has urged, and start investing in the child, it'll come back to us, even out of self-interest, economically. You will save the nation money. Instead of, at the moment, yes, we must provide care, but what is happening is it is all too late for so many of these people at that end of this process, of this pattern. I mentioned seeing what happened in Native American communities. It is the global experience that convinces me that yes, we can do here what the Americans did. Because 30 years ago, when I was pointing the four corners camera at the First Nations and hearing those racist excuses, I'm pleased to say that they came up with a program to change things. And today, those people who were dying between 12 and 16 years before white Americans, the life expectancy gap is closed to just 3.5 years. When I've been to the Sami nations in Europe, they have equal life expectancy in Sweden and Norway and Finland. Across the Tasman and New Zealand, also, by investing heavily in health and education, they have largely closed the gap. Yes, racism remains, but the truth is here in this country, Indigenous people have close to the worst health among any nation anywhere. According to the UN indicators on this, only the most impoverished rural Chinese live with a worse quality of life than our Indigenous citizens. We have to change those issues of poverty. The diseases I've described are made so much worse by poverty, because heart disease and renal disease, obesity, these are international things, yes. But when you are living in poverty, it is so much worse. I'll give you a very simple example. The diseases of poverty, like scabies, make things so much more dangerous for that young mother. For a child living in poverty, the illnesses that we eliminated 30 years ago, we have among those communities in the Northern Territory the worst rheumatic heart fever on earth. This is connected to the simplest things that have not been treated. Skin sores, pyoderma. In fact, they are the pathway for rheumatic heart fever. Streptococcal infections travel in through those sores. If we had treatment, it's an injection of antibiotics once a month. With no treatment, that child that I've seen going through the worst months of rheumatic heart fever, the illness gets to work on the muscles and the valves of the heart, and there is the greatly increased risk of early heart disease because we didn't deal with skin sores. And as Fiona Stanley has told us, there are so many ways to get down to looking at that child and seeing how to position the right support. The trachoma that you hear about, the disease, the respiratory infections, all of these things are fairly simple, but you have to have in place primary health care. You have to invest in primary health care, and you have to have a health force that is capable of delivering primary health care. And what I learned overseas is that where communities have succeeded in changing this breakdown, the key, without question, is education. It is lifestyle education. It is health education. Professor Ted Wilkes, an Aboriginal scholar in Western Australia, and Fiona Stanley turned up one rather shattering conclusion in their landmark study of Aboriginal health in Western Australia. 49% of those young mothers I'm talking about continued to smoke while pregnant, and about 23% drank alcohol while pregnant. But the next paragraph in the study says, not only that, they had never heard a health message explaining that this not only affected their own health, but the health, the lifespan of their baby. Obviously, we need urgently a health education program to target, to explain to that young woman that it is the future of her child that is affected. And we have to do that in a way with the right people, whether it's Kathy and Ian, or somebody who can actually reach people. I don't mean more paper or scary television ads. I mean messages that reach the community and say, this is about life. In Cherbourg, over the last few days, which is in Queensland, north of Brisbane, an Aboriginal principal said to me, Chris Sara, he said, education, that is the way that we are going to be healthy. And what he says in that community is strong and smart. How does that work? Well, it's something like this. A health worker in the Northern Territory showed me the study. Globally, we increase the education of that young teenage mother by 1 year. Roughly speaking, the life expectancy of her baby can be increased by as much as 4 years. What a challenge, what an incentive to get this right. In those same communities, at the moment, I am seeing 93% illiteracy in the Javan communities. Bookless homes, places without schools or preschools, communities where people travel 150 kilometres in the morning if they go to school. Education is the first step. Health education is an essential part of overcoming this health emergency. When the American Surgeon General, David Satcher, came out and visited some of the sick communities in Central Australia, he was reluctant to give advice, but someone kept pestering him. And Dr. Satcher said, education, education, education. Because it was, back in the United States, affirmative action, recognising the patient was many times sicker, disadvantaged, living in a terrible house. Something else that we're going to address tonight is to explain that these social indicators, it is these aspects of health. Professor Jim Hyde at the Australasian College of Physicians estimates that for each one of us, about 70% of our health is determined by the house, the job, the education, whether you believe you have a future, whether you have a path to a better future. These things are crucial, and it is in many of those aspects that each one of us can contribute. You don't have to be a doctor or a medical student. You have to be a citizen, or you have to take a small step like Claire and Will, my own children, who sent the right boxes of books that an Aboriginal teacher asked them to send to a tin shed that became a preschool and led to a project to build up health and health education in the small Javan community of Woogala. Each one of us must take that step. My own children remind me that it is possible if we take that step, but we must remember it's not about race, it's not about us and them, it's about the human race. It's about all of our children. Thank you. Thank you for taking it. Got my watch in the